So the next thing we're going to do is we're going to do something called a procedural preparation. That's two very big words. So the reason why we're going to do it is because I know you for a long time. I know Mommy very well. And what Mommy has told me is that you've spent a lot of time in the hospital.
Yeah,
true. Very true.
11 brain surgeries.
11 brain surgeries.
And all of them I had to get an IV, which I did not like.
You do not like IVs. You don't like needles. They're not fun.
Yeah.
No, not fun at all.
Every time I cried.
Yeah, you cry when you get them. They're uncomfortable. They're painful.
Really painful.
Yeah. Something else that Mommy told me that you've had to get that you do not like is something called a shunt tap.
Yeah. That is the worst thing in the world. Worse than the IV.
That's worse than the IV. So what I did today, I brought some materials, just a few things that you probably will recognize. This is a random bag. You're probably going to recognize them. But before I do that, I'm going to take these out. I want you to decorate this doll however...
I'll probably sleep with it.
Yeah, and you absolutely can. You can do whatever you would like because we're going to do a shunt tap on this doll. That's cool. So you have your markers. You can decorate this doll. Okay, so while you do that, I'm going to start to pull some of this stuff out.
Yeah, I recognize that. That's
you
a shunt
recognize
tap.
them. Mm-hmm.
Did you use Sharpie?
I didn't use Sharpie, but you can use any markers on here. I think I used markers just like you did. I just had regular markers.
Like wash off markers?
Yes, exactly.
Watch this. Watch what I have.
Oof.
This is rainbow.
A rainbow. The little spots, right? A.
S-H-E-R. I have letters to make my name. That kind of looks like an R. I couldn't do it on this. I'm gonna do like light green around his eyes, which I'm really good at.
You're really good at getting some green around those eyes.
Cause see, I didn't put a little on the eyes, but only on one eye. I'm just gonna do it like a little on his eyes.
Just a little bit.
Yeah, light. And this guy's done.
He is done. Okay.
Watch. Yeah, I couldn't do it. I tried to put a Pokeball.
You put a Pokeball there?
Yeah, I couldn't do it. And done.
Okay, done decorating him. Do you want to give him a name?
Asher. That's why I had an A-S-H-E-R.
So we're going to name him. Okay, so Asher has to get a shunt tap.
Ooh, I remember these.
You remember, you know what that is.
Yeah.
So, do you want, there's a role, we have a patient, we need a doctor, we need a nurse. We can have
Doctor, you're a nurse.
You want me to be a nurse? You're the doctor. We got our patient. So, you're looking at some of the materials here. There are things
Yeah, I
that...
remember this. This is part of the shunt tap.
Okay.
No, wait. I think this is part of... No, yeah. Shunt tap. This is
You want
part
to pull...
of this.
You can pull out whatever is in there.
Okay.
You want to pull it out. So
I'll should do this first.
You want to do that first. Okay. So... Ooh.
Do you just get this? Is your friend a doctor and you just got this from him?
So, you know that I am in school and I'm studying to be a child life specialist.
My mommy is doing nursing.
Mommy's doing nursing, so she probably knows what this stuff is.
Yeah.
She
definitely knows what this stuff is because I was in the hospital and she's doing nursing.
Right. That you've been in the hospital so many times, so now she's doing nursing.
What? Are we going to cut this person's body up?
Ooh, we can cut that up if you think that's what we should do.
Nah, definitely
not for a shunt tap. So let's see. Now you pulled this out of here. This is, whoops, that's interesting.
This kind of looks like the boat, right?
So they call that a butterfly needle.
Yeah.
So
Definitely looks like a butterfly.
Looks like a butterfly. So, I've done a little bit of studying about how to do a shunt tap. But I'm just the nurse. You are the doctor. So, you can tell me what
I'm so good at this because I've been in the hospital like 1,000 times.
1,000 times. Oh my gosh. So, I wonder what we can start with. But if you're the doctor, does the doctor wear some of these things?
Yeah.
Or should the nurse? What should we do?
I should wear this.
You're going to wear those.
And I'm happy that these are this size because my hands are probably these size.
Yeah, I think I got the small ones.
Good. Yep.
Get those gloves on.
Yeah, this is hard when I already have one of them on.
Oof, snap, get it on. Huh. Okay, so you can tell me what's gonna come next. Oh, we've got a mask.
Yeah.
But if you'd like to, it's here. You do not have to use it.
Yeah, I don't want
You do not have to use it at all. So we've got some other things here, huh? Do you want to we can maybe open some of these things? You want to pull them out?
Syringe.
No.
Needle? Yes.
Okay,
You tell me open it because I do not want to poke myself. And it's hard to open it with gloves.
You are absolutely right. So I will open this up. So because you are very right. There is a needle in there. There is a needle in here, and there is also, this is just a pretend butterfly. We took the needle out. I have another one here that does have the needle in it. So when they do a shunt tap, they use a butterfly needle. This is what they use. Okay.
And I always cry for shunt taps too. And I'm laying down when I'm flying like all over like a fish.
Oh, like a floppy fish.
Like I'm a fish out of water.
Right, flopping around. You're nervous when it's gonna happen.
Yeah.
They give you medicine to help keep you calm. Now, do you know, I think because you've been in the hospital, you probably are very familiar with child life. Yeah.
I always go there.
You always go there. What do you do when you see the child life specialist?
I usually pick out movies.
Movies, right? So, sometimes they do, child life specialists will sometimes come into the room.
Yeah, I saw like volunteer for that, and we made like a tape. What is it again? Wallet, tape wallet.
You made a tape wallet. So sometimes the child life specialist will come in and do cool things with you to kind of help you
Yeah.
stay calm and do fun stuff. So they'll also help you by doing what we're doing now, something called a procedural preparation. We're going to use medical play, which is what this is. We're playing with medical stuff. This is real stuff, right? You agree this is real stuff.
Yeah.
But we're just playing with it. So we're going to use it to help get you ready. And this is not really happening to you, right?
Yeah.
You're not in the hospital right now.
Yeah.
You're not sick.
Yeah.
You're the doctor.
This is like a little hospital for him.
This is a hospital for him. So what we're doing now.
Who's there?
This is Shabana. This is Andrea.
Hi.
How are you?
I'm a doctor right now. I'm a doctor.
Okay.
I'm a doctor.
Listen, I'm all for it.
This is my office where I'm doing stuff. So
Listen, I'm good.
I'm in the office right now.
Oh, you are? Okay.
Okay, doctor. So this is our patient. So I'm the nurse, but sometimes they have child life come in and help prepare a patient for this.
Wait.
So, yeah.
Oh, should we get Daddy up here for child life?
You want someone to be the child life specialist?
Yes, Daddy. I'll go get him.
Okay. Because Daddy's got to speak to the nurse that's here. Okay. So for now, we'll pretend we're gonna have the both of us do.
Can I just do one more thing on it?
You can do whatever you want to do. Absolutely. Okay. So he's got something brown on his chest.
It's my watch. It's this.
Ooh. What is that from?
I forget.
You forgot what that's
Heart
from.
surgery, I think.
Oh, you had heart surgery. Because you've got a lot going on with you.
Yeah. A lot of scars.
A lot of scars.
So he's ready.
He's ready.
Hello. We're medical play. My, when you're done, can you please be the child?
Yeah, that's okay though.
Can you please be the, when you're done, can you please be the child life specialist?
Sure. I'd like to.
So, so if we're gonna start, what do we need to do? I think I might
Shunt
know.
tap.
We're gonna do the shunt tap. So where do they do that?
Like right here.
Kind of right there. So we'll kind of make that our spot. So before they do that,
I'll put like a,
you're gonna mark it.
yeah.
Yeah. That's the spot.
Now I'm just gonna, this is just a mask to trick people. He's gonna look like Pac-Man with his eyes. But this is just like trick, just like a mask.
Okay, so we've got our spot where we're gonna do this shunt tap. So before, we have to make sure that the area is nice and clean. So there's something that we use.
Use all.
Ooh.
I need help opening it.
You want me to help?
It's so hard with these. Here, actually, I'll just take them off for now.
There we go. Okay, so we gotta make sure we get that all clean, nice. Ooh, that smells strong.
Really strong.
That's a strong smell.
Good.
Very
Nice
good.
and
Okay,
clean.
it's nice and clean. Let me make sure it's clean. Alrighty, so
This is pretty wet now.
yeah, it is. So, but that's okay though.
It was fine.
Alrighty. So once we have the area clean,
What is this?
we'll do something with that right after.
IV advantage.
IV advantage. So what do you think they use that for?
IVs.
An IV. So you think?
Like it's that stuff where they wrap around you.
Do you think you want to do that afterwards?
Yeah.
Okay. So now we have the area clean. Huh.
Should we do this?
So why did you pick this spot? What's here?
It's shunt.
This shunt. So is that
And that's where they do it to me, right here.
they do it right there? Kind of. So that's why you chose that spot.
Yeah.
That's kind of where they're gonna do that. So you like that?
Yeah. This is pretty strong.
Yeah. This is the strong rubber band they use before they give you the IV, right?
Yeah.
It helps show where your veins are.
Yeah.
Okay.
Like
So
they do like Yeah, and then they wrap around so they can really see it, and then they do the needle.
Exactly. So now we've got our spot here where our shunt is, like you told me. So yeah, get that glove back on there, doctor. Right? So do they sometimes, they lay something over your head so that it's a nice clean area?
Yeah,
Right?
I think.
So what we can do is we can do pretend. We're going to use, like you recognize, this is our butterfly needle.
Wow,
we're
this
gonna,
is pretty hard.
So we're going to play
Can we
pretend.
finally get this glove on?
Yeah, you want me to help you? No problem. So let's see, we're actually going to go. Yeah, you're right. Okay, good. We'll go this way.
No.
Yeah, get that thumb in there. It's tricky. The pinky's got to get over there and now. Get that pointer finger.
Yeah.
Pinky finger. Ooh, that's hard to get on. Yeah. Okay. So, we're going to do pretend first.
Why do you have one with a needle and pretend?
So, we're going to maybe practice first.
Okay.
Because I am going to take out
This
one.
is part of this.
Does that go in there?
I don't know.
Okay.
Maybe.
Let's see, maybe it does. Maybe it goes like that.
No.
No, you don't think so.
Because this is where you take out the blood.
Right.
So. Yeah, no.
That doesn't. So this is the end, though, that we use. So once the butterfly needle goes in, what are you going to do next, doctor?
I don't know.
You don't know. Should we just try and we'll see what we're supposed to do? So, should our patient be sitting up, laying down, on his back, on his belly?
Back.
You want him on his back.
Yes.
So that's what he's doing now.
Yeah.
Okay. So we clean the area.
Wait. I have a doctor suit in my dress up, I think.
You have a doctor suit. Oh, yeah. You should
I don't know.
take a look. Yeah. That will complete the outfit.
Yeah, no.
Oh, that's okay.
I used to. It said Dr. Rasher, and then I grew out of it.
Okay. So what they do is what the doctor does. So we're going to all just pretend. I'm going to say now, but you're the doctor, so you're going to actually do it. We're going to take the special butterfly needle. And they have to just go right into your shunt a little bit. So it pokes, it's a little poke. It's going to go through your skin.
How did you take out the needle, though?
Oh, I had someone who knows how to do that. I didn't know how to do that. So it's going to go just right in, under the skin, into the valve of your shunt, which controls, right? It's going to control how much fluid is coming from your brain, right? Because your shunt goes from your head all the way down into your belly. It goes into your belly. So this tubing goes long. So we have to stick it right inside that shunt, right there. And it goes in, okay? And then the doctor uses a syringe, which is this.
Yeah, I know which syringes
Yeah.
are. I use them all the time.
You use them all the time. Can you get that out there?
Yeah.
Get that out for me? Thank you. So we've got, let me just make sure there's nothing else. Oh, that was the next thing. So this is our syringe.
Can I just go down? I'm gonna go downstairs and get a drink. I'll be right
Want to get
back.
a drink, right? Well, we don't really have anything inside this doll, right? He's just got cushion inside. So we want to show what happens when that butterfly needle goes in. And so good, we pulled out our syringe. So what the syringe does, it's attached to,
We need that for the IV.
right?
And this, the real one.
It's attached to the butterfly needle. So we go,
Yeah.
right? Let's see, we feel the air. So what it is, this goes in, okay? And maybe it'll be your job. You want to just hold it right there. So we're inside our shunt, right? We're checking, because it's gonna go. And what we're gonna see here is fluid. That fluid was in your head. That's the fluid that surrounds your brain.
But what do you need that for then?
So yeah, you're curious why I have you get some water. So we're gonna kind of just practice and use something. So what I'll do is
Because maybe I'll be a doctor
you're gonna be the doctor.
when I grow up. I'm
Yeah,
probably
you,
gonna go to the same school as mommy for nursing. Yeah.
okay. So what I'm gonna do is, you like that tourniquet, huh? So what I'm gonna do is I'm gonna pull out my other package with the actual
Whoa,
needle.
where is it?
It's gonna be under this cap here.
Alright.
All right. Do you feel comfortable if I did it with you?
Yeah.
To do it, do you feel comfortable I can do it with you?
Yeah.
Oh, of course it retracted.
What does that mean?
Darn it. Of course. It went up inside of itself. It went inside. Darn it. That's okay. You know what? These are the things that happen. Let me just make sure. You know what? That happens sometimes.
That taped thing is that one where we played, that was pretty fun. And this guy looks so
Yeah.
cool.
Alrighty, well you know what? That got stuck up in there. So we've got something else that's going to be very, very similar. So what it's going to do is,
Awesome.
yeah, it is
Can I
awesome.
poke it in?
So you think you'd like to do that. So what they'll do is, we've got our little spot here. So you're going to hold it down here. Let's see. Okay. You're going to hold it down here because this is a real needle.
It's probably like that pokey thing in my science kit.
Yeah, right? You got to be very careful. So what we'll do is, you want me to do it first and then you?
Yeah.
Okay. So
Actually, can you open it and then I'll do it
you want to do it, you want to do it together or you want to do it by yourself?
myself?
Okay, so you're going to hold it down here. So here you can hold the bottom, so be very careful. And then where is that going to go?
Right here.
All right, so we're going to do it nice and gentle. Oof, he's upset. He's crying.
Now, what do I do now?
So now, you know what, we're going to just keep this in here. They're going to draw. We're going to pretend like we've got our butterfly needle. But that's how the needle goes in, right? That's going into the valve. Right? Right,
I'm gonna
so-
do a cry face on
Do a cry. You're gonna make it like
Oh,
he's
wait,
crying.
that's the tear. I'll just do a little more tears. These are tears. Blue spots. That's a giant tear. That's a floppy tear.
So what happens then is, we're gonna pretend like this is your head, because there's no liquid in there. So we have to just pretend. So say if the butterfly needle went in, they've got a special vial that's gonna help take blood, or that's gonna look at the what's coming out of your brain. So usually it's a syringe. So it looks something like this. So you know what? We'll do a little swap through. It's a syringe. So it's gonna go in, and there's fluid inside your brain.
Guys, can I pick it up?
You want to pick it up, so let me just make sure this is connected, okay? Let's see what happens if you pull that. Ooh, what do we see in there?
Fluid.
You see fluid, right?
Yeah.
There's liquid.
This is so fun.
This is fun, right? This is just water. Because look, I had you bring me water.
Yeah.
It's just water. But that is what is the fluid that's inside your head sometimes. Because you have something called hydrocephalus, which means you have a lot of fluid on your brain. It's all around your brain. It's stuff that keeps your brain healthy and clean, but sometimes our bodies...
Will this come off if I draw on it?
I think it will. So sometimes you're... Whoops. Whoops. Our patient.
Is your patient scared?
When we did the
What a
needle,
very good question to ask, Mommy.
Mom, when we did the needle, I went like, wah, wah.
Yeah, you made our patient cry, right? Do you want to show Mommy how you did the needle?
I see his scared face. That's why I asked his mouth.
Yeah.
Exactly. Mommy sees that you drew tears on him because he's a little scared.
Yeah, the blue stuff is the tears.
It is.
Here, Mom.
Our butterfly needle broke, so I had an IV though. So we're
I
gonna
can't
pretend.
find a chair for you, sorry.
Oh, that's okay.
That was the only chair.
Okay, so what is Mommy's role when we do our shunt tap? What do you want her to do?
Do you want to watch?
Yes, you want to watch.
Okay.
So she's just gonna watch.
Yes.
So now our role is gonna to be, what should the baby do when this is happening? What should our patient do?
Lay down and be calm.
Be calm. Can we do something to help him be calm? What do you think we can do? Do you want to bring him a toy? Right? So he's got his little toy. So now what are we going to do? Should we count for him? Should we count down from what?
19.
From 19. We're going to count down from 19. So he's
19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, here it comes. He's crying. Okay, and so now it's gonna be over. What are we gonna do again? That was just to show the little needle prick. So now, let's get our butterfly needle and syringe. So now we're gonna pretend like we're inside your brain. We're inside the shunt valve. Okay. So we've been there. Now what is the doctor gonna do? Suck it all in. Okay, so we'll stop right there. Okay, doctor.
Wow, that's a lot of
You
fluid.
see the fluid. Okay, doctor, how's the fluid look?
Good.
It looks good. Is our patient healthy?
Yes.
Okay, is he gonna need surgery?
Yes.
He is gonna need surgery. Oh my goodness.
And IV.
And an IV. Okay, so we did our shunt tap. We've decided that our patient needs surgery.
I want to show Mommy that one.
Oh, this fell.
Look. So, this one has a cast. Its leg fell off.
That happens sometimes.
It
And,
does.
and your tears are much better than mine.
Oh, that's okay. No, I liked your tears because you made them. So
And
they're
I like
good.
your tears because that shows that he was crying a lot.
A lot. It's
And
upset.
that
So,
happens when
I
you-
threw back all my money in there.
doctor, we need to do an IV. Oh my gosh. So, yeah, you're right. You grabbed the tag. You knew exactly what to grab.
I'm gonna
Smart
take
boy.
off my gloves because
Yeah.
that's very hard to get it with.
It is right.
Um,
Okay, so, doctor,
yes.
which arm? Do you want to be the patient? Just for a second, we're going to let you be the voice of the patient. Patient, which arm should we use for your IV?
That's one.
We're going to use this one. So,
Because mine usually is on that one, right?
Do you know why yours is usually on that one?
More veins.
No, because you like to use your right hand to do stuff.
And
So it's easier
he's
to have
gonna
it in
be-
your left,
And
right?
his name is Asher, so he uses his right hand.
My favorite name.
of course.
Top the thing. Mine, what is this for again, though?
This goes on top of the IV to keep it in place.
Oh.
Do you recognize that though?
My favorite is this.
No.
It's so strong.
I know.
Watch.
Watch your face.
I'm so bad at that.
No, you're not.
How do we do it again? Wait, I remember. Like, first you do this, and then you put the needle in. And what are we gonna do with the fluid?
Send it to the lab. Make sure there's no infection in your spinal fluid.
This is a lab.
Good
Okay,
idea.
so we chose our arm for our patient to get. That's the lab. You brought the fluid over to the lab. Okay, so now what we're gonna do is, so for our IV, we use the same needle for
Yeah.
the shunt tap, but we know this is for the IV. This is what it looks like. Does it look? It looks familiar, huh? So for right now, the needle went into the tubey. Thank you. So what actually goes into your arm is this. You want to feel it? Because guess what?
What?
That's not a needle.
I know.
It's just a little tube. This is what actually stays in your arm. You don't have a needle in your arm. So because our needle got retracted, and I didn't mean for that to happen, we're gonna do minor surgery.
Oh.
You wanna place the IV. So for now, I disconnected it. It's just gonna go in that little hole. So again, we gotta prepare our patient. What's the patient gonna do when this happens? He's gonna cry. So we want to count down
Yeah.
from what?
10.
10.
10, 9, 8, 7, 6, 5, 4, 3, 2, and 1.
Oh,
Wah, wah, wah.
he needs his turtle to comfort him. right? So our IV
His name is Mr. Turtleface.
goes into our veins, and then doctor, we gotta put on the special bandage.
How do you put it on, Mommy?
Let's see. Oh, see.
Mommy's
knows
pretty
how to
good at
open.
this.
Mommy is probably very good at this.
So I know the first thing you do is take this part off, right? Then put this on your patient, and then you could take the other.
So what we're gonna do is we're gonna try to keep this spot where it's open, so that the nurse can get to it, so she can work with it. So we're gonna put the sticky side down. So we'll just make sure that it falls right like that. Okay.
Yeah. So is this gonna stay on him?
Mm-hmm.
Nice.
This is like real stuff right here.
Yeah.
So you can. So I'll make sure that stays in. I'll hold that in while you want to put the tape on.
Yeah.
No one can be poked twice, right?
No, they do not. Nice job. You did a very good job listening about how this.
On the doctor.
You are the doctor. Okay, go ahead, doctor. So what we do when it's all done, they take this paper off.
This what? This is just blood. This paper?
Yep. You want to take that off?
Yeah.
Is that part? Yeah, it's okay. That part comes off. That's all right. Ta-da! Ta-da! So now, look at all this. What is all this goobly goop? What does this do?
Mom, what does it do?
You're asking
You
mommy.
know what that does.
Wait, I
What
know.
does this connect to?
IV.
Ah, I think you want to try and connect it.
To give
Nice job.
To
And then
do
this part
water.
goes up into what? Do you remember from the hospital?
water?
It looks just like water. It's called saline. Exactly. It just gives your body water. It's special water for your body. It's a little salty. Like you don't drink salt water.
How do you do it though?
So I don't have the actual bag for it, but this is what I used to. I used it for something else. So it's going to connect, and it's going to go all the way up, and this is what all the fluid does. And this is going to control, kind of like the valve in your shunt, right? You have a little tube that's in your body. This is going to control how much of the special fluid goes into your IV.
This is so fun.
This is so fun. You like this? And this is a little rolly wheel. You want to roll the wheel,
Yeah.
and you push it. It's kind of hard.
I can't do it.
Right? So it's going to go up here. So now everything's flowing nice and loose. So we're going to move it and then it stops it. So if we don't need any more fluid, it stops it. Okay? So our patient had an IV. Our patient has had a shunt tap. Oh my gosh. Our poor patient. Okay.
What is this for then?
How is,
Is this next?
So we actually use that when we're going to be doing the IV, or when you get blood taken, right?
Yeah.
Have you had that done before? So where do they tie that rubber band?
Arm.
On your arm. You want to demonstrate on me? You want to demonstrate on the doll?
Actually, you.
You do on me. Which arm should I do? I'll do this one. Oh, nice. Now you look for my veins, huh?
No veins.
No veins. Oh, I just have no life in my body.
And that was easy to get it off.
That was pretty easy, right? And they do it so quickly. So this is our patient. He's got his IV. He's got his shunt tap. How is he feeling?
Very, very sad.
Really sad. How come?
Got so hurt.
So hurt. It's painful, right? It's very painful. So what do you think made it easier for him, or could have made it easier for him? He's got his doll, right?
Turtle.
Help him make it a bit easier.
Mr. Turtleface.
Yeah. And this was also a lot for you to be able to talk about and play with. I know you said you're having fun, but you spent a lot of time in the hospital too, and I know you've been very scared. So I'm glad this is what we do to help make it a little bit easier. I'll let you play with it, right? Was it fun to play with this? Yeah.
Really fun.
It was
What
really
is the
fun.
tape for then?
Oh, it can be for whatever you want it to be. We got tape, we got gauze, we got extra tubing. This is all for you.
Where's the gauze?
I think I've got, and I know I saw Mommy's got plenty of gauze in the closet. I noticed. It's this one. This is a bigger one. I think I have a big one and a small one. And tape. There's another alcohol prep pad. Something else I'm sure Mommy has plenty of. Yeah.
This is awesome.
This is awesome. I'm glad you had
Then
fun.
this would be so long though.
I know, right?
How can I sleep with it?
Right, when he's laying in the bed, the IV pole's next to him, right? And it works through the night. Exactly. Oh my goodness. Well, thank you for letting me play with you.
You're welcome.
Thank you so much.